What was important for me this year at ASH was the first presentation of the results of randomized trial using interferon alpha in patients with MPNs. So we have presented the results of the so-called PROUD-PV that randomized hydroxyurea versus a new formulation of interferon, which is the Ropeginterferon alpha 2B in patients with PV as a first-line therapy. And hopefully this study met its endpoint, that was the achievement of complete hematological response at 1 year of treatment. So beating Hydrea is a bit difficult in this disease on the short term because Hydrea works well, well-tolerated, efficacious drug, but the advantage of interferon for us is on the longer term. So the first step was to prove non-inferiority of interferon compared to Hydrea on the short term, 12 months. And now this study is continuing with a different name, which is CONTI-PV, and we will follow the patients for the second and the third year and hopefully find this time, with this longer follow-up, superiority of interferon, especially in terms of molecular responses, for example, and hopefully also for occurrence of vascular events. The MPD Consortium in the US also showed preliminary results of the study comparing also Hydrea to another form of interferon, pegylated interferon alpha 2A. So this was also very preliminary. Only 36 patients were randomized in both arms compared to a total of 170 patients. But already this study found also very comparable results between two drugs at 12 months. So this is also encouraging, and we have to wait for longer follow-up, and maybe next year they will be able to show the final results of this trial. So we will have two trials comparing head-to-head let's say the most commonly used drug, Hydrea, to two forms of interferon alpha, and also the PROUD-PV study is a registration study. So hopefully we will have, if the study is accepted by the authorities, for the first time an interferon that is approved, labeled for patients with MPN, because currently we still use off-label interferon for our patients.